Hello everyone, welcome to Bone Doctor. As I've been discussing in my previous video about diabetic foot, how does it occur, why it is so important to understand. So in this video, I'm going to discuss about the symptoms of diabetic foot so that any person who is suffering from diabetes be aware of such symptoms and consult doctor immediately so that diabetic foot doesn't lead to diabetic gangrene and ultimately amputation, which is a very sad outcome of diabetic foot. Whenever it starts with a peripheral vascular disease or a neuropathy. So let's understand what is peripheral vascular disease. Whenever a person is suffering from chronic diabetes, chronic uncontrolled diabetes, that's the most important word here. That means the person's blood sugar is more than 300 to 400 milligram per deciliter. That person will suffer from damage of his arteries and veins. That is, the arteries will become thicker day by day and the lumen, the thing through which the blood flows in our arteries, will become smaller day by day. Due to such reduction of the lumen of the arteries, the blood supply to various vital organs decreases in a person of diabetes. It mostly affects the peripheral limbs, that is the hands and the foot, because there the size of the arteries are the thinnest. Due to reduction of blood supply to the hands and the foot, the muscles of the foot, the bones of the foot, the skin of the foot suffer from low oxygen and low nutrition. Thus, the skin appears pale, dry, broken out. If you touch a diabetic foot, it may appear to be cold as the blood supply is reduced in these regions. The skins may have ulcer as the normal damage repairing capacity of that skin has decreased. And if we palpate for pulses, the peripheral pulses may be reduced or absent in a diabetic foot. Next important thing which happens in diabetes is neuropathy. As the blood supply to the muscles decrease, so are the blood supply to the nerves, peripheral nerves which supply the hand and the foot also decrease. Thus there is a huge damage to the nerves of the hand and the foot. Due to damage of these nerves, the sensation of the hand and the foot, mostly the foot, decrease. Thus a person suffering from diabetic foot may have loss in sensation of the foot. Means he may feel the foot, the skin of the foot has thickened out, he is not feeling the floor or the shoe is going out of his foot. He can understand whether the foot is holding on to the shoe or not. The person may have motor neuron damages to his foot. That is, the muscles of the foot may lack the signaling system of the nerves, and thus the person may develop hammer toes, claw foot and excessively arched foot. This happens because the motor supply to the muscles of the foot has been decreased or has completely been absent due to excess damage to the nerves of the foot. These are the pictures which we see in a diabetic foot. When this diabetic foot advances, there is another thing which we notice, that is neuroarthropathic foot. That is, whenever a diabetic patient with no or least amount of sensation walks around, there are damages or injuries to the bones and the joints of the foot. A normal person feels that there is an injury to the foot or injury to the joint. So he stops back. He waits until the injury heals. He waits after the fractured bone heals up. But when a diabetic person encounters a fracture or damage to the joint, he doesn't stop his walking because he has no pain. So this leads to further damage of all the joints and the bones of the foot, which results in a neuroarthropathic foot, which is also known as Charcot joint, in which all the bones of the foot are completely damaged and the joints are also damaged. So the foot is grossly deformed and it is very hard to fit a shoe into that foot, and the person finds very difficulty to walk with that foot. The proprioception, the sensation of the foot, is also gone. That is, the balance mechanism of that person also gone. So the person of a diabetic foot may encounter frequent falls because he is not getting a feedback from his foot, whether he is standing or he is walking, and thus he loses balance. So there are episodes of frequent falls in that patient. The foot appears osteoporotic. The bones of the foot are osteoporotic. The calcium have decreased because the blood supply to the foot has been markedly compromised. And the last and the most important symptom which a person has in a diabetic foot is infection. This is the most important symptom which we as doctor fear the most, because a diabetic patient, as we know, has a very low capacity to fight out infection. If he has an infection of a throat, if he has an infection of lungs, we find it very hard to treat. The foot is constantly exposed to the floor, to all the germs, to all the dust and oil. So there is a high amount of chance that this foot is exposed to huge amount of pathogens. These bacteria get inside the foot through the small ulcers which are created in the skin, and that gives rise to huge ulcers, infections, which spreads from skin to muscles to bones and ultimately to osteomyelitis. If a person has got osteomyelitis of the foot, a diabetic foot, then it is very hard to treat. The pus goes on continually coming out from the foot, and it eventually spreads to the whole body. So in order to save the patient's life, we have to perform amputation and we have to cut out that diseased foot from that person, which is a very sad outcome. So this video is all about for you people to understand the symptoms of diabetes foot, so that if you are suffering from diabetes or if you are any loved ones are suffering from diabetes, they will be aware of their foot. They should keep their foot in good care and look after their foot, so that none of the person ever lands up in diabetic foot amputations. If you find this video informative, do share it to your loved ones. If you have any experience of diabetic foot, please comment, and if you like this channel, please subscribe. In my last video, I'll be talking about prevention and treatment of diabetic foot, which is a very important topic. Don't miss that. Take care, all of you. Stay healthy, stay safe. Bye bye for now.